One of the interviews we had yesterday, we were hearing from the DA member of the Gauteng legislature, Jack Bloom, who had received numerous complaints about parking issues at Charlotte Maxeke Hospital, saying it's not just affecting staff, but also affecting the service to those who need it most, the patients at the hospital. Painting quite a bleak picture, but there were talks of plans. Let's find out now from Infrastructure Management, the director of it, Ayanda Dakela, joining us this morning from the Health Department. Ayanda, good to have you on eNCA. So just help us unpack where we are. I don't think it needs to become a mudslinging match at all. We're all trying to get to a point of solving the issue. Where are we on the parking issue? What can you tell us?
Good morning, Gareth, and good morning to your viewers. Gareth, I wanted to bring a perspective. We, as the Department of Health, we are concerned about the delay that has been caused on the project. You may remember that the fire started last year, in April last year, and we are more than a year from that moment. Recently, there was, at the beginning of this year, there was few concerns that went to the Office of the Presidency around the progress of the project. In that, basically, there was a request that was made from the presidency asking the Minister of Health to intervene on the issue. On the 27th of January this year, there was a meeting between the minister and the premier of the province. And within that meeting, it was agreed that the project will be handed over to National so that it can be given the priority that it deserves. I must say, to date, we have opened the emergency unit. It is fully operational. 2 months ago, the engineers did a detailed assessment on the area that was affected, which is Block 4 and Block 5. Remember, this assessment was supposed to be done after the fire last year, but unfortunately that did not happen, and we still don't know what was the cause of the fire. So the detailed assessment, basically, it gave me some options that I can use in terms of building a temporary parking. The plan is to build about 400 parking bays for the staff that can be accommodated within the area that was affected by the fire. We're going to be putting some concrete propping, permanent concrete propping on that area so that we can stabilize the structure so that the staff can be able to park there. So that will be done, will be completed later in August. I wanted to clarify that. Another issue that I wanted to clarify, Gareth, the hospital has made an arrangement for parking. There is a parking that can be used within the facility, but it's on first come, first serve. Yes, more parking is still required outside, but the hospital also has made arrangement regarding the outside parking, and they have indicated to the doctors and nurses that if one is working late, there is a transport that a hospital transport that is going to be taking staff from the hospital to where they parked. So there is an arrangement around that area. What we are what the management has done, though, they have made some communication to the local councillor, asking the local councillor to assist with the street lighting. If the local councillor is listening, I plea that they must assist the hospital and fix the street lighting. Even if the mayor is listening, I'll appreciate if they can assist.
Yeah, and we're all trying to get to a solution on this, aren't we? So, Mr. Dakela, just before I say goodbye to you, let me just make sure I understand, because this was just to get a sense of what the parking situation looks like currently. So 400 parking bays will be made available for staff. That's coming up in August. Right now, there's still parking, first come, first serve. That is for patients and transport. Just talk to me about the transport very quickly. Is the transport available for patients and staff backwards and forwards to their cars?
Yes. Let me clarify another thing, Gareth. There is about 200 plus or minus 200 parking bays for the staff, for the medical staff inside, but it's on first come, first serve. Coming to the issue of the transport. So if a doctor or a nurse is working late, there is a transport that can assist them in terms of taking them from the site, from the hospital to where they parked. At the same time, the hospital, the management of the hospital has also encouraged the doctors and nurses that if one knows that he or she is going to be working late, they must bring their cars inside so that the cars can be safe inside and then they can work until late. So that message has been communicated to the doctors and nurses.
How many parking spaces did we lose as a result of the fire, Mr. Dakela? Because we're talking about 400 extra parking spaces from August, and right now there's roughly 200 extra, you're saying. How many did we lose?
We lost more than 1,000 parking bays because the Block 4 and Block 5 was damaged completely, and the slabs collapsed, everything collapsed. So now what we are planning to do, there is 200 plus or minus 200 parking bays that is there currently. By August, there will be 400 more. So that means then we'll be having about 600 plus or minus. And then by July 2023, we'll be done with Block 4 and Block 5. That means then the full parking bay will be open for the staff.
So we're looking at probably just over a year from now to get back to where we were, Mr. Ayanda Dakela. I appreciate your time in coming on to speak to us. So reacting to the concern raised by residents and doctors to Jack Bloom from the DA yesterday. I'm not sure if Jack Bloom is watching, as well as all the other interested stakeholders, the health department saying there are plans in place, 400 new parking bays or extra parking bays for staff from August. Right now there is a parking bay, first come, first serve, and there is, and they want to emphasize this, Ayanda Dakela saying there is transport available for staff and patients. So if you're not aware of that, just make sure to speak to the management at Charlotte Maxeke, and there should be transport available. Of course, we'll check in and follow up on that, but I appreciate Ayanda Dakela's time this morning. Here's Nandi with sport.